Cleocin Phosphate Vial is a medication that is used to treat a wide variety of bacterial infections. It works by stopping the growth of bacteria. It is important to note that this antibiotic only treats bacterial infections and will not work for viral infections such as the common cold or the flu. It is also important to use this medication only when it is needed, as using any antibiotic when it is not necessary can cause it to not work for future infections. Additionally, it is important to know that this medication should not be used to treat meningitis. The dosage and timing of this medication should be determined by a healthcare professional, and it is important to follow their instructions carefully. When using Cleocin Phosphate Vial, it is typically administered by injection into a vein or muscle as instructed by your doctor, usually 2 to 4 times a day. The dosage will be determined based on your medical condition and how you respond to the treatment. For children, the dosage will also be based on their weight. If you are administering this medication to yourself at home, it's important to learn all the preparation and usage instructions from your healthcare professional. Before using the medication, visually inspect it for any particles or discoloration. If you notice either of these, do not use the liquid. Make sure to also learn how to properly store and dispose of medical supplies. To ensure the effectiveness of the antibiotic, it's important to maintain a constant level of the medication in your body. Therefore, it's crucial to use this drug at evenly spaced intervals. It's important to continue using this medication until you have finished the full prescribed amount, even if your symptoms improve after a few days. Stopping the medication too early may lead to the infection returning. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Cleocin Phosphate Vial may include nausea, vomiting, an unpleasant taste in the mouth, or pain at the injection site. It's important to remember that this medication has been prescribed to you because the benefits outweigh the risks of side effects. However, if you experience any serious side effects such as persistent nausea or vomiting, pain or swelling at the injection site, dark urine, or signs of kidney problems, it's important to contact your doctor right away. Prolonged use of this medication may result in oral thrush or a new vaginal yeast infection, so be sure to contact your doctor if you notice any new symptoms. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as fever, rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're taking Cleocin Phosphate Vial, it's important to be aware of the potential side effects. This medication can rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur weeks to months after treatment has stopped. If you experience symptoms such as diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to contact your doctor right away. It's also important to note that if you have these symptoms, you should avoid using anti-diarrhea or opioid products because they may make symptoms worse. Always follow your doctor's guidance and never hesitate to seek medical advice if you have any concerns. When it comes to taking this medication, be sure to follow the prescribed dosage and schedule provided by your healthcare professional. This will help ensure that you receive the maximum benefits from Cleocin Phosphate Vial. Remember to take it at the same time each day to maintain a consistent level of the medication in your body. Before using Cleocin Phosphate Vial, make sure to inform your doctor if you have any allergies to clindamycin, lincomycin, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Additionally, inform your doctor about your medical history, especially if you have kidney disease, liver disease, or stomach/bowel disease such as colitis. It's important to note that Cleocin Phosphate Vial may cause live bacterial vaccines to not work well, so be sure to inform your healthcare professional if you are using this medication before getting any immunizations/vaccinations. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, be aware that you may be more sensitive to the side effects of this drug, especially diarrhea. If you are pregnant, make sure to inform your doctor before using this medication, as well as if you are breastfeeding, as this drug can pass into breast milk. Be sure to consult your doctor before breastfeeding. When using Cleocin Phosphate Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. This will help to ensure the safe and effective use of Cleocin Phosphate Vial. As for the daily dosage, the recommended dose and frequency of administration will be determined by your doctor based on your specific medical condition and response to treatment. It's important to follow your doctor's instructions carefully. It's best to take Cleocin Phosphate Vial at the same time each day to help maintain a consistent level of the medication in your body. Be sure to complete the full course of treatment, even if you start to feel better before it's finished. This will help to ensure that the infection is fully treated. If someone has taken too much Cleocin Phosphate Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Your doctor may perform lab tests, such as checking your kidney and liver function, while you are using Cleocin Phosphate Vial. Be sure to consult your doctor for more information on these tests. Cleocin Phosphate Vial is used to treat serious infections caused by bacteria. It is usually given by injection into a muscle or vein as directed by your healthcare professional. The dosage is based on your medical condition and response to treatment. In some cases, this medication may also be given by injection into a vein over at least 10 minutes. The optimal timing for taking this medication will be determined by your doctor. Make sure to take Cleocin Phosphate Vial as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for a missed one. Cleocin Phosphate Vial is used to treat serious infections caused by bacteria. It is typically given as an injection into a muscle or through an 4. The dosage and timing of administration will be determined by your healthcare professional based on your specific condition. Always follow your doctor's instructions and never adjust the dosage on your own. Be sure to check the product instructions and consult your pharmacist for storage details. It's important to keep all medications out of reach of children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.